Welcome, Phyllis. This is another episode of MGTOW Clinic. This episode, I'm going to talk about the real reason why you can't trust a female. This is pretty much based on what I've seen at work. You know, since I'm in a healthcare field, I've seen a lot of these cases. Alright? 10 years in, you know, I have my fair share, you know, seeing different things. So, I'm gonna give you guys my perspective of why you can't trust a female based on my experiences in the healthcare field. Now, I've seen a lot of men comes in with, you know, with life-changing events. What that means is that either you had a stroke, you're in an accident, you had a brain injury, or you had an accident that you are, you know, that you had a spinal cord injury. All right, and those are what we consider as a life-changing event, because with stroke and with a brain injury, you know, a lot of times that your physical capability is diminished or gone. Your memory, your mobility, even the way that you chew and swallow is being affected. Now, spinal cord injury, that's pretty much cut and dry. If you're paraplegic, you know, obviously you can use, you know, your legs. If you're quadriplegic, then you can't use anything at all. All three of these life-changing events they all affect, you know, different parts of your body. You know, not only whatever that I said earlier, but you know, you don't know. How can I say this? You become incontinent. You piss on yourself. You shit on yourself. Sometimes if it's bad enough where it affects the way that you swallow to the point that you're not safe to swallow anything, then you are being fed through a gastric tube. What that is a feeding tube that goes in directly into your stomach, and we feed you with the tube, give your medication through the tube, and that's how you're gonna get your water, your nutrition, and your medication is through that tube. So that being said, you know, those are life-changing events, and believe me, 10 years in the healthcare field, I've seen quite a few. And I also seen a lot of women, you know, where man, you know, gets sick or gets injured on a day of admission. These women, you know, comes in like all gun-ho about it, saying that, oh yeah, you know, I'm going to take my man home, I'm going to take my husband home, I'm going to take a real good care of him. And then when the day of discharge, or the week before discharge, the women is nowhere to be found. Alright? They either giving us excuses, oh, I'm not ready, the house is not ready, this ain't ready, that ain't ready, I can't take him home. Usually in that case, you know, once again, I'm just being realistic about it, man. Hospital need to make money. Alright? If we don't make money, we can't keep the doors open. It is what it is. I'm sorry, fellas. That's life. And especially, it doesn't matter what kind of insurance that you have, whether or not if you're legal, illegal. When you get sick, you deserve health care. But healthcare facility need to get paid. I need to get paid. All right. So anyways, back to the story. So now, so the social workers and case managers, they ultimately says, okay, enough's enough. You play enough games, telling women, if you don't take them home, we're going to start charging you $5,000 or $5,500 a day. All right? Rehab is not cheap. And so these females heard, oh my God, $5,000 a day. Holy shit. All right, well, throw them in the fucking nursing home. So a lot of these guys ended up in the nursing home. Now, okay, I gotta be fair, all right? There are cases where, men are the primary breadwinner and women are pretty much, they're a stay-home mom taking care of kids, and they don't have any job skills that they can really use, to make a good, decent living. I can understand that because, kids need to be fed, rent need to be paid. It is what it is. In those kind of situations, I understand. I just saw the fucking R35 GTR passes by. Well, I passed by them. Now they're behind me. Fucking GTR, man, they're fucking awesome cars. I'll tell you that right now. But anyways, and there's also some instances where, the kids are grown, they're well-to. The wife or the girlfriend really take the man home, really take care of them. But you know what? Those are too few and far between. They're like 3 out of 10 cases where the women will take the man home. Now that being said, on the flip side of the coin, 7 out of 10 men or 8 out of 10 men will take their wife home, or the men will take their girlfriend home to take care of them. So that being said, women, and those women who have, the kids are grown, they're well-to, retired, got a lot of money, a fucking fat-ass bank account, kick-ass pension plans, well, whatever, money is no object, but they still decide to kick the man till the curb. And believe me, fellas, I've seen a lot. 10 years. I ain't trying to lie to none of y'all. Women's cannot be trusted. Alright? Now, if you're brave enough, if you want to throw your dice, roll them. Depends on, you want to, depend on your women to take care of you through, those life-changing illnesses, you're more than welcome to. Alright? Incontinence, you piss and shit on yourself, you can't eat, so you gotta be fed through too. You can't use either your legs, your arms, or one side of your body is all it's all fucked up because of the stroke or brain injury. Those it's a very tough patient population to take care of. But I've been doing it for 10 years. I find, to me, it's a very physically demanding work, but, I love it. I love to do this. Otherwise, I would have fucking do something else. I wouldn't be staying in this kind of, rehab services for 10 years. I would have do like fucking trauma. Motherfucking see your ass for like about fucking 2-3 hours and then fucking send you to ICU. Next. That's what I'll be doing. But I love rehab. I love these patient population. I've seen, because I do see results, and that's why I love the job. I fucking love it. Motherfucker, like, if you ain't got love for the game, get the fuck out. But I love the game. That's why I'm staying in it. 10 years and counting. But anyways, so fellas, definitely, health is wealth, all right? Take care of yourself above all else. But if you have kids, then your kids come before you. But always take care of yourself. And then here's a phrase that I want you guys to remember, all right? Because you've seen a lot of females doing this shit. A lot of these females love to put tattoos on them, different parts of their body, and they always love to put loyalty. Loyalty. Let me tell you something, fellas. These bitches, number one, they don't know how to spell the damn word, let alone know the fucking meaning of the word loyalty. Alright? So here's what I want you guys to remember. This is women's version of loyalty. They are loyal to their need of you. Once their need changes, so does their loyalty. Alright? Once again, they are loyal to their need of you. Once their needs change, so does their loyalty. Alright? So that pretty much means that, like if you had a stroke, brain injury, or, you become paraplegic or quadriplegic, you'll have to depend on them to do a lot of things for you. Now, since you're in that predicament, these, once again, 7 out of these 10 bitches, they don't want to give up, they don't want to bother with you. They don't give a shit about you. They'll fucking throw your motherfucking ass in a goddamn fucking nursing home. Now, if you have money, you can get yourself into a real good nursing home where they can take real good care of you. But, hey, that costs money. But if you don't have money, then you gonna go to some Joe Blow nursing home where the facility is like fucking biting fucking toes and nails and shit, try to save a buck here and there, where they running a fucking skeleton crew, to take care of like fucking 40, 50 patients at a time. And once you're into that kind of facility, let me tell you guys, that's literally, that's a fucking life sentence. And worse, that's a fucking death sentence. Alright? Hey, listen, man, I'm just letting you guys know beforehand, letting y'all know what's up. What the fuck is going on here? Why is the fucking traffic? But anyway, so yeah, health is wealth, fellas. Health is wealth. Fuck everything else, man. Gotta take care of yourself. Alright? And, yeah, so, like, once you're into the nursing home, that's it. That's it. Life as you know is gone bye-bye. Oh, boy. So, that being said, guys, definitely protect your necks at all times. Put yourself above all else. Don't believe these females, man. Like, motherfucking like, oh, I love you, honey. I'll take care of you, honey. Oh, for better, for worse, honey. Get the fuck out of here. Shit. These bitches, like, once they see that you're When you become when you became a liability, that is it. Then their true self will definitely come out. Don't believe me? Hey, go around and ask your friends. Go around, like look at different people, the different people that in a similar situation. Alright, family courts, you already know. Motherfucker, you don't go and see your kids. You don't go and have no custody. And on top of that, motherfucker, bitches ain't gonna take care of their kids, but you gotta pay alimony. You gotta pay fucking child support. And you don't even see your kids. Once again, fellas, I know I sound like a fucking broken record, but I'm trying to drill it into your brain, man. Women, they are loyal to their needs. Once their need changes, so does their loyalty. Alright? When you become a fucking liability, and you'll know what I'm talking about. So fellas, protect your neck at all costs. Alright? So hopefully this video definitely give you guys some insight on why you can't trust these women. Once again, definitely like, subscribe, comment, and share. Let me know what you guys think. The good, the bad, or if I need improvement, please comment down below, and definitely like, subscribe, and share. That's pretty much it, fellas. Next video, what I'm gonna talk about is when you have to put up with these females at work. Alright? So stay tuned, fellas. You might pick up something from me. And hopefully you do. Alright, this is MGTOW Clinic signing off.